So this next segment, we're going to do the slim part of BeSlim, because we talk a lot, don't we? So under the S for slim stands for support. And this is a huge aspect of long-term weight management success, according to the weight loss success stories.
And it's probably the most important part of BeSlim, because without the proper support, it doesn't work. And they've shown that. They've shown that people actually on this program, on MediFast, the old MediFast, before Take Shape for Life came around, that even if they went on and they got the products and they did their thing, it doesn't work. If you do not have the support around you of people that know what they're doing, and certainly your physician involved, I mean, I believe, I'm biased of course, but quite honestly, with some of the complicated patients we have with high blood pressure and diabetes, and mostly high blood pressure and diabetes, the cholesterol, it's kind of a silent disease, but hypertension, I will tell you, we see it, and we see it quickly, diabetics as well. So without that support and without that team support of the health coach, and us communicating regularly, I don't think it's going to work. Tell us a little bit about the health coach, Renee.
Absolutely. And so, again, let's go back to that National Weight Loss Registry. All those people who were able to not just lose weight, right, but keep it off, because that's really the key. We all know diets don't work, right, because it's something that we think in our brain we're going to go on a diet and go off. So when we're actually really trying to change lifestyle, this requires a lot of commitment on the part of the person doing it, and part of that commitment is gathering your team's support around you, and that is what a health coach is there to do. Our certified and trained health coaches, along with our healthcare professionals, are people who live the BeSlim philosophy. We have all been on the program. If we needed to lose weight, we've lost our weight. If not, we use the products for optimal health. We're walking the talk, and in doing so, we've learned how to do it, sort of what kind of mental and emotional things come up with this, and how we can support people through it. Now, it's important to understand that a health coach, if they're not a healthcare professional, we are not there to medically diagnose or treat. We are not trained psychologists or psychiatrists, so if you have any of those types of issues, that's not what we're there to do. We're simply there to explain the program, to share it, to help you with any ordering, etc., but to just be there to motivate, to be there to inspire, to be there to encourage, and to have somebody there that you can be accountable to.
Now, if I may interject, I want to say our coaches, we found, because Renee is our team leader, and I will tell you she's done a phenomenal job of helping to lead this team. But one of the things that really we brought to the table was the coaches understanding what the physicians need. And I think that's a critical component. So for instance, we've learned that by day 7, day 10, our hypertensives are calling and saying, Dr. Adolny, I have to stop the program. Something's wrong. I said, whoa, hold on. And we'll find that, sure enough, their sugar's too low if they're diabetic, their blood pressure's way too low if they're hypertensive, and a lot of times we are treating them to have, the medicines they're on need to stop. And we're over-treating them, essentially. And it's quite satisfying to do that. But we would have never known that had the coach not been aware that dizziness was available, that dizziness was happening, or that they just weren't feeling well and they didn't know the diagnosis. So if a coach were to go into this blindly and not really understand what the implications of diabetes are, what the implications of renal insufficiency or kidney problems was, if they didn't understand what the underlying problem was by having a physician at the helm, I think it would be very, very difficult.
Absolutely, and so that's what a health coach is really there to do. It's there to give you support. It's there so that you have a comfort level in knowing that you're in this program, it is for you, but you're not by yourself. Not only do we have the one-on-one with our coaches, and by the way, our one-on-one is pretty much however you need it to be, because we know that we have such busy lives, and that's why we love these simple, easy-to-use tools with the meal replacements. The same with the coaching. We do our coaching via the phone, via internet, we in our area do have meetings if that's something that somebody chooses to do, certainly not mandatory. And Take Shape for Life provides a wonderful interactive online support system called Support in Motion.
With both a nurse and I think there's a physician on as well, right?
We have nurses' calls that people can get on and ask questions. We have doctors' calls. A lot of times Dr. Anderson or Dr. Picarara or Dr. Nelson, any of these doctors also who are working very specifically with the program. So you are not alone. And that is a huge aspect of this program. So that is the S in BeSlim. And I think that is in and of itself its own segment.
It
so
really
this
is.
part, we're going to stop.
We'll get to the look.